when you read the literature, you notice that women who are of higher education levels or higher income levels tend to have less children.
If we are doing that, we're asking people to have more children, but who is helping us to plan?
Motherhood sounds very unattractive. Pregnancy sounds very unattractive to me.
Why is it that a woman is only considered a woman if she has a child?
Every look you look is always birth rate, birth rate. What, did you ask anybody about their pap smears? Did you ask the girlies about their PCOS symptoms?
Everyday Period removes the mystery, the stigma, and awkwardness surrounding reproductive health and brings empowering real conversations to the forefront. This is a space where we talk with real people about real experiences, honestly, openly, and without shame, to normalize conversations about periods, bodies, and reproductive health as a part of everyday life.
The first question is, from your perspective, what are the biggest factors influencing Jamaica's young people's decision on whether or not they want to have children?
Hello? Oh, okay. Hi, good afternoon, everyone. As they introduce, I'm Jade. Jade is fine, please. I'm Jade, medical doctor, content creator, and a young girl. So, I think when we approach this question, we have to look at it from multiple areas, right? Well, let's talk about health. I'm a doctor, fine. So I find what we're seeing now, especially as not only technology but medicine enhances, is that we're finding that, okay, maybe really and truly it's not that, oh, your periods are painful, but you have endometriosis. And happy Endometriosis Month to my fellow survivors. It's March, yes, you have on yellow, nice, okay, right? So in addition to that, when we're crippled with all these things, first of all, we have to sort out the medical part of it in terms of the expenses, the bills. Also, the money, right? A lot of our young people, if we're being frank, if we're employed, we're underpaid or we're overqualified for a position that we're in. That's number one. In addition to that, we need sustenance to take care of a possible child. So it's not necessarily that you don't want to have the child, but picnic expensive. And the fact of the matter is, say for example, I'm somebody who loves to travel, I love to enjoy life, but how am I going to do that, palm a paycheck with a picnic, right? When it comes to doctor's visit, when it comes to, Doc was talking about the fertility rate, it's $75,000 to store the embryos, okay, for the year. That's it. That's the cheapest thing that you'll get out of it. So the cost is one of the things, medical, and then obviously the lifestyle. As we get, how do I say this? As, you know, times become more modern and women become more empowered, we realize that, hey, as a woman, I don't need to have children to be whole. Now, don't get me wrong, you are whole if you're a mom, if that's what you want. But there are many women out there who are saying, well, you know, this is not the lifestyle for me, this is not the sacrifice that I want to make, and I'm whole without a child, right? So then you also have those people who are becoming more empowered and realizing that, hey, my purpose as a woman is not only rooted in motherhood and fertility. So those are a few of my thoughts on that question.
Anybody want to add anything to that?
Yes, I would. Rochelle Graham Barnes, and I'm a mother. I was almost a geriatric pregnancy.
At what age do we start calling it geriatric? What, 30?
35.
35.
And it depends on which country, because some countries put it earlier. All right, so for me, I would just add to what she just said, just the emotional and the mental preparedness. So for me, for a long time, and Dr. Spence will tell you, I was unsure whether I wanted a child because I was not mentally there. So I thought about different things like, how am I going to make the sacrifice to say, if I want to get up and go about my business, who's going to take care of the child? If I want to do all of these things, I couldn't see how it is that I would put aside, I would make all these sacrifices and still be the kind of mother I saw my mother be to me and my siblings. So I had to decide, when is this going to happen? So my then partner, now husband, and I spoke about it, and he was like, okay, all right, we work around it, but one day you'll come to my side. We'll have the conversation. We're still going to get married, and we'll work on that. And we made some goals that we wanted to achieve before. And this whole time, you had people who sat and looked at my womb every single day.
Oh, and asked questions.
We were married for over 5 years before we had our daughter. And my daughter is the best thing in the whole wide world. She's the most precious baby ever. But I am happy that I waited until I was mentally and emotionally ready, because we also had this child outside of Jamaica in a country where they don't speak English. So I was in a room with only my OBGYN actually spoke English. Everybody else was around me talking all kinds of other languages. And so had I not been mentally and emotionally prepared, then it would have been a very traumatic situation. It snowed on the day, everything, half my family couldn't come to visit me. So all of that, you have to be in a space. So yes, the financial part of it is important, the health part of it is so important, but the mental part, the emotional part, my first thought was, as soon as I pick up the child, I'm gonna break her. So that was where I was until I got to the point where I was prepared to do that. Because if you're not whole in terms of you being where you need to be, then you can't give to a child, you can't give to anyone if you're not in that space.
That's an important point. I'm happy you mentioned that. But before I delve even more into the emotional and mental preparedness that we should go through before we consider parenting, let's just call a spade a spade. 100% of parenthood is motherhood. Now, fathers are important, and fathers need to play a part in the journey of parenting, but let's call it what it is. They are not as required to be involved the way, like the chicken, the way mothers are. What do you say about the feeling that motherhood is the calling of a woman? Because that is still a part of the discussion, is why isn't it that all of us are not just having babies because that's your purpose in life as a woman? What are your thoughts on that thought process that we still embody even in this time today?
Hi, everyone. My name is Amoy. Sorry if I sound a bit hoarse. I'm a bit sick. But my perspective, honestly, I'm 21 years old. I'm still pursuing my undergraduate degree. Motherhood sounds very unattractive to me. Pregnancy sounds very unattractive to me. From what I can see right now going on in the world, I feel like it isn't fair to bring a child into this world. Especially now at my stage, all I can hear around me right now is the birth rate is going down and we all need to contribute and whatever. I just don't feel like right now in my stage of life I should even be considering it, because what good will that promote? Like, what good will that do my life, right? And I feel like a lot of times I could be called selfish because I'm thinking a lot about me, and I was told before, like, what about the child? What child? The child does not exist. So I definitely feel like motherhood in this stage of life, it's not attractive. It's not something that I'm necessarily looking forward to as well. Maybe a few years down the line, but right now, it's not attractive.
I think a lot of what contributes to the question that you asked is societal view.
Yes.
Why is it that a woman is only considered a woman if she has a child? And that's something that I do not believe in. I think that a woman is a woman once she considers herself a woman, and once you're fulfilled as a woman. I don't think that a child needs to dictate that. And I think now with women empowerment, we're moving away from these kind of societal norms. You want women who want more fulfilled lives, women who want to travel, women who want to try new foods, who want to see the wonders of the world. You know what I mean? And I think that from that kind of a perspective, it shifts it, that we can recognize and appreciate the beauty and the diversity, that you can have a woman with no children who is fulfilled. And you can have a woman with 1 child, 2 children, 3 children who is fulfilled. It doesn't make either of them any less of a woman.
All right, so let's talk about that. If we're looking ahead, and I am a magician, call me Harriet Potter, here's my magic wand, and I could give you everything that you want. You expressed an interest in wanting to have children. You have children already. You say it's not attractive. You didn't really state your position, right? But if I could wave a wand and give you the perfect scenario that will make you want to have children, tell me what 2 of those things would be. No. Well, duh, we know I said the man need for that, eh? Okay, so let's assume an involved, attentive father. We assume that.
Okay, we're assuming.
What else? My magic wand is ready to be waved. Go ahead.
Okay, for me personally speaking, number one, Mrs. Barnes actually spoke about it, my emotional state. Personally speaking, I have the best mother on earth, and nobody can tell me otherwise, right? And my mother has always said to me, she's so glad that she waited to have me. She was also near geriatric, 33, when she had me. And she said she got to experience her life, she got to make her mistakes in her 20s, she got to establish herself as a woman, so that in the event that the attentive father, my father is great, he's there, he still sends me money, thanks Dad. But, in the event that he was not there, she could mentally and financially take care of me. So the preparedness is one thing for me. And I think possibly the stage in life, you said 2 things. Ooh. All right, so preparedness. I think the stage of life would also be a part of that. Also, for me personally speaking, it's not impossible, and it's very possible, but I want a well-equipped medical team following me through the entire pregnancy. I know that sounds crazy.
You mean like your own personal
Not
medical
personal.
team?
I don't need them for personal, but I need a multidisciplinary approach, because that's how we talk about in medicine. It's not just, your body. It's not just your womb alone. It's everything else, right? Okay. So personally, I suffer with endometriosis. So already the fertility looking a little sketch, right? We talk about the man already. We'll see how that goes.
No, well, you see, in my magical world,
yeah,
this
man
is also rich, because based on where you ask,
right,
you need money.
The money, Guys, you know how much is for a teen of Enfamil? $5,000.
Yes. We.
For one teen, and that's not the big one. Anyways, not the point. Right, so from my perspective, and obviously I'm biased because I'm a healthcare professional, but the fact of the matter is, for me, especially as someone who's plagued with reproductive issues, I would like that type of follow-through. As I said, it's not impossible. We have many capable specialists that are here in Jamaica working. Maybe we need to be a little bit more out there with it, right? And I think in general, our health literacy, especially for women's reproductive health, which is something that I'm very passionate about, I think it's not at the forefront.
I know this.
The birth rate, every look you look is, it's birth rate. What, did you ask anybody about their pap smears? Yeah. Oh, did you ask the girlies about their PCOS symptoms? Yeah. Oh, right. That's the point. So the healthcare part of it, right?
So I'm hearing preparedness and healthcare, proper healthcare. Go.
All right, so for me, I think my top 2 would be 1, financial stability, which I feel like is just going to be across the board. But then the second one for me is, I think, the social reforms of the country. So what kind of education am I going to be able to offer to my child? Am I going to have to spend $500,000 a term? Just for them to get what I think should be considered the basic. Exactly, so there we go. And what's going to be the access to healthcare? How is my child going to grow up? Am I going to have to lock the grills and double bolt the door? Can my child go outside and touch grass? Will my child be able to do all of these things? So I think for me, it's definitely, and I feel like for everybody, being able to, 1, afford the child because they are expensive, but then also 2, what kind of environment is my child going to be growing up in?
Okay. Yes?
All right. So for me, I think both of them kind of said it, is the healthcare. So that would have to be in place, because I remember when there was COVID, and I sat there thinking, I said it to my husband, we're not doing anything now because I'm asthmatic and I'm not going to go in the hospital to have a baby with my asthma during COVID. And that was, for me, I'm very concerned about having the right things in place. But I will also say, because of where I was, I had access to so many things. So for me right now, I'm concerned, do I want to have another child in Jamaica? I'm very, very concerned because of what I got for healthcare outside of Jamaica, what I got from my experience there. I don't know.
So that's a major factor
That's a
for you.
major factor for me. And as well, I think it was you, Shelly, and Dr. Spence said something about the community that provides that support, that tells us, not necessarily tell us how to be parents, because then that will go into mom shaming and all of that, but just some guidance as to providing support for you that you need. So women have to deal with the triple burden. So how do we make sure that even we have to look after our mothers, we still have to look after the child? So that support that is required,
Yes.
that village.
Yes, all right.
For me, I guess you guys kind of said pretty much everything. Although something that kept coming back to me in my mind was, how can I ensure that I won't perish while giving birth?
Sounds to me like you're still concerned about the healthcare.
Yes.
Yes.
Because I don't know, I feel like it's quite concerning, just the mortality rate
Yes.
of women when they're giving birth. It's quite scary when you look at it. Also, I'd like to be very well off. I feel like children are extremely expensive. I am extremely expensive. I'm very well aware of the fact university is extremely expensive.
Oh, and it gets more expensive when you finish university, don't worry.
Exactly.
Life is expensive.
I just feel like it's very, very expensive.
Yes,
and-
all right. Oh, you
like-
finished? Sorry, you finished? Go ahead.
Yes.
You finished? Okay. I'm coming to your question. I'm going to ask them one last question, and then I'm going to turn on a loose. Huh? Oh, it's pertinent to this. All right. Give her the microphone, because we want to hear what she has to say.
My thing is,
Take the microphone. We want to hear what you have to say.
thank you. Good afternoon. I'm very close to the speaker. Again, good afternoon. My apologies for my voice. I'm sick. But my thing is, everyone stated about the financial and the health care, but where are we going to raise this child? Because housing is expensive. We no longer can pay $2 million to say that I have a down payment on a house from NHT. So if it's a case that, okay, you are going to wave your magic wand, of course, big up you and your magic wand. I think that one thing we should say is that, can we get a house and a car?
A house and a car.
So that we can at least have somewhere
I will have to
raise-
recalibrate my wand, but I'll work on it.
so that we
Yes.
have somewhere to raise the child.
Yes.
And if we would hate to walk to the health center
With the umbrella and the bag
with
on
the
your shoulder.
umbrella and the bag on the shoulder and the
Yes.
thermos in the hand
I
and the baby
understand.
on the other side.
Yes.
And from someone who has taken public transportation in Kingston, after going to a high school in Kingston, teenagers and other people are not quite kind to pregnant women. And I myself have seen that, where we were not quite kind, for the fact that there are some pregnant women who are mean, and one statement I have made was, I wasn't the one that got you pregnant, so get pregnant for someone who can drive. So, so I think that a house and a car is nice.
Let me ask this question, please, I beg you. Take the microphone there for me, please. Don't worry, audience, you get a chance to participate. I just have to ask this one last question of my panel. Women work. Jamaican women are working women. I know we watch TV and there's a lot of conversations about the woman's place in the home, and we need to stay at home and make bread and fry bacon that the man is going to bring home from his work that he has. It's important work, and clean house and these things. But for the most part, Jamaican women are working professional women. What kind of adjustments can be made on a policy level that will be more supportive of us having more children, that you personally think should be implemented?
Okay, so deep sigh. Okay, from my perspective, especially, well, Dr. Dunbar can obviously attest to the same. The hours that medical doctors work in Jamaica are absolutely ridiculous, if we're being frank, right? Right now, I'm living a lovely life because I work in a health center in rural Jamaica. I just work from 8 to 2 on a Monday to Friday. But say, for example, I decide, well, I would like to follow in Dr. Dunbar's footsteps, and I want to go through with postgraduate training, and I want to go to the hospital. When I'm there, for 32 hours, going on 56 hours, going on 72 hours, how does that work? We're working women, as you said. And even for women who do work at 9 to 5 from Monday to Friday, it's still very taxing, right? So from a policy level, I know that maternity leave is something that is offered, but also I think paternity leave should be a thing, right? Where, especially if we're trying to push.
Paternity leave, yes, it's a thing.
In terms of, okay, a little bit more developed, I should say, because it's not as broad, wide scale as maternity leave. Because I've seen in the case where certain companies don't allow it. They'll allow maternity leave, they won't allow the paternity leave. And the fact of the matter is, somebody has to put food on the table. So if it is that mommy is healing from the baby, it's been 3 months, she took her 3 months of maternity leave and she decides to go back to work. Who's at home with the baby? And it's not that everybody wants to leave their child in the care of somebody else. They want to be active, they want to be there, they want to take care of it. So I think we need more robust paternity and maternity leave.
So you want longer maternity leave?
Right, so that's one. Number two, not longer, but I think the policy should be a little bit more strict, especially throughout companies. It has to be a across the board thing. It can't be that, oh, we offer it, but we don't offer it type of thing, right? In addition to that, healthcare, right? So the fact of the matter is that we're there in the hospitals. We see what it's like. Sometimes you can barely even find the thing that we need to clean a belly for C-section, betadine, right? Just to clean it off. It can't be that we're trying to push more children, and we don't have little things in our public hospitals, right? Because the fact of the matter is, the public hospitals make up the majority of Jamaica, right? We have private hospitals. Of course, people give birth there. They have their money, they're well off, that's fine. But what about the middleman, right? We need our healthcare system to be more equipped from a policy standpoint. We need more things, we need more staff, we need more resources, more imaging, things like that. So policy in terms of paternity leave, maternity leave, healthcare, I think that's on a policy level, things that can be made, especially to ensure that we're properly enforcing this and not just thrusting this on women. Oh, go and have picnic.
Okay, all right.
All right. Feel like I can go to town with this one.
Oh, Lord.
I do feel that the beginning of my answer is going to be a little bit biased, just like Jade said, just because we're healthcare workers and we tend to work some hours that I won't even mention. Just know that it's not humanly possible. So one, the hours that women work, I think at least trying for a 40-hour work week, I think that would be more reasonable. If it is that, as doctors, if it's possible for us to work in 8-hour shifts and actually still be able to make, have a good payday at the end of the day when that is done. So definitely increasing the salary, 2, adjusting the work hours. The second thing Jay did mention in terms of the maternity leave, I think our maternity leave needs to be longer.
Have a recommended period that would be satisfactory?
6 months to a year.
6 months to a year?
Yes, and the father should also have access to that. And on that note, I also feel like there needs to be some sort of a social policy where the mothers are more supported. So I think Dr. Spence made the point with she mentioned Scandinavia, but Scandinavia is not actually the only country that does that. There are other countries that they have a package for mommies that supports her once that baby comes. Mm-hmm. And I find that a part of the key thing that is missing from this journey, we're looking at pregnancy. But what happens before the baby? What happens after the baby? Where's the pre-pregnancy care? Where's the postpartum care? Postpartum depression is a real thing, and it's something that we need to talk more about and not just be so taboo about it and so quiet about it. The women need to be more supported, and I think that we need to have those kind of measures in place. So those would be the major things for me. Final thing, aftercare for the baby. I don't know what happens at other people's workplaces, but I know that in the hospitals, for example, they used to try to have daycares for the babies where the doctors and the nurses could leave their children. And it's really sad now. If you go to most hospitals, they're very dilapidated or they don't exist. These kind of things need to be, and not just at the hospital, at any workplace where you have women, which I'm sure will be everywhere. There needs to be some sort of an aftercare support system where a woman can know, my baby can be here, my baby can be well taken care of. When I'm finished doing what is required of me as a career woman, and I can put on my mommy cap, go for my child, not have to worry about, the care that the child is getting and spending an exorbitant amount to be able to get that kind of care.
Right, so we need child care, we need longer maternity leave, a more robust paternity leave. No, you don't get one more. We're going to find out from over here, so.
It's a sentence.
One sentence, quickly.
I was saying that I think NCB still has it, but my mom works at NCB and they have the same aftercare system that she's speaking about, where there's a daycare that was free to their staff, where we as the children were able to go after school. We got meals, we got healthcare, there's a nurse
more than
there.
one company in this Jamaica
Right,
has
so
it as a
I think that should be
benefit.
a policy across the board, like
Yeah.
she was saying.
I think that was my point, actually, about the aftercare. But also, I'm looking at what are the things that we have in place. So there was the parenting commission that was there, and as Dr. Spence says, it's no longer there. Where do we find that support now?
You mean National Family Planning
National
Board?
Family Planning.
Because parenting commission still exists.
I'm sorry, right. So if we are doing that, we're asking people to have more children, but who is helping us to plan?
So you need more support.
So we need more support to plan, to make sure that what we're doing or what we're thinking or what the government is expecting, because we are at a state where if it is that the government is asking us to have more children, what is the government putting to us to say, this is how we will support you having more children? Because then we're fixing part of a problem and creating another one. So we always have to make sure that even though we're asking women to do these things, we are also putting things in place to support them. So it's providing that support, the family planning and the parenting support to make sure that we're getting all the tools that we need to do well as parents. And it is a little bit, maybe not a policy perspective, but simply having conversations. We're having this conversation here, but having conversations in spaces where people are more appreciative of the fact that really and truly there is the idea that I do not want to have children and not shame me for it. So
Yes.
even though we're having the conversation about having children,
children.
but having the conversation, the other conversation that says, I do not want to have a child and I
that's fine.
should not feel less than for it.
Makes sense. Yes, my friend would think parenthood don't look attractive.
I don't want to be known for that. Okay, so I think maybe what I was thinking about was maybe more regulations being placed on housing.
Okay, tell me about that.
Yeah, because as a young woman, right now I'm thinking about what am I going to do when I finish with university. When I leave, where am I going to live? Because I can't go back I'm from country. I can't go back to country and still pursue a career in what I choose to, like media and communications. I can't pursue a career from country and come back to town, and it just won't work out. Housing in Kingston, it's outrageous. It's outrageous. And I don't see where the government has any form of regulations when it comes down to how these prices are actually made.
Okay, so you want more control where housing is concerned so that
Yes.
it becomes more affordable.
Right.
Yes.
And like, if I were to have a child right now and still pursue a career, where am I going to have that child? Where are they going to stay? As well as even after birth and all of that, like, where is this child going to stay while I go to work?
All right.
Are there enough regulations being put in place so that these things are actually taken care of and it's not just an afterthought?
Okay, so I am hearing that from the policy standpoint, we need to not just look at the child and giving birth to the child, but we need support. And support in form of affordable housing, postpartum care, pre- and postpartum care, longer maternity leave, better health care, and you spoke a lot about aftercare at work, childcare at work, and we need an organization akin to what the Family Planning Board was to help support and educate. Because I agree, there is a gap in the education about reproductive health. It's something that I've been trying for 10 years to address, and it really is something that must be addressed. So I thank you so much for your input. Hi, Catherine. Catherine Lloyd has joined our panel, and I'm going to ask her, just give her about 5 minutes really quickly to just Her area of expertise is research. And I like people who research things, because they know the things, they know the nitty-gritty, they have the data. And I'm very interested in data because if we are going to actually solve this problem, we need to know the data. We need to see what is happening so we can see how we can do it. Because you know what they say in business, if it's not measured, it doesn't get to...
It's not measured.
It
it's
doesn't
not done,
happen,
it didn't
right?
happen, yeah.
So if we actually are serious about solving this issue, we need to understand what the research says. So Catherine, I'm going to give it to you, and you just tell us what you know quickly.
All right, thank you so much, Ms. Weeks. Good evening, everybody, or good afternoon. I hope you're all well. My name is Catherine Lloyd. I am a reproductive health researcher, a resident advisor here at the Mary C. Cole Hall, a biochemist by profession, and currently my Master's of Science in Biomedical Research. My research is focused on women's health, specifically, the factors that affect women's decision to have children. And so when it comes to the reason that I decided to do that, it was actually a redirection from something else, because my focus is really menstrual health, reproductive health on the inside. But what I noticed is this conversation is happening and nobody's really asking what people in university have to say. Because when you read the literature, you notice that women who are of higher education levels or higher income levels tend to have less children. And so, for the people who want children to be born, this is where they need to be focusing. Women who are in university, women who are working at a higher level, who are ambitious and driven and want careers for themselves, which most of us do, right? Right.
Right.
And those women are the ones who are driving the decline, because those women are the ones who are making the decision not to have children based on their circumstances, based on whether they can find a partner, whether they are comfortable with their careers, or even the timing. Because many of them, they want children, but don't want children right now. So when it comes to the area of fertility as a sociological and medical concept, fertility has several elements, and I'm going to focus on two of them. Fertility desire and fertility intention. You hear me? Fertility desire and fertility intention. So what desire speaks to is whether or not somebody wants children, independent of socio-demographic circumstances, independent of socio-political circumstances, cultural circumstances. Do you want children, yes or no? Right? There are other elements of desire as well, which have to do with how many children somebody wants, or at what time in their lives they might want children. But all of these things are not grounded in reality. They're grounded in the mind. As for the intention side of things, intention is grounded in reality. Intention has to do with what you plan to do with your life. So what you plan for yourself. So for example, I may say, I want 3 children in the future. I would want to start having children by 25, and I would want to, right, so I want children, right? So I want children, I want 3 children, I want them by 25. But in reality, I'm 23 years old, do I have dollar to my name, do I have a house, not married, not where I want to be in my career. So in reality, it may come out that maybe I don't have children, or maybe I only have 1. Maybe I only have them by 30. Those things change your intention. They influence your intention. So the research that I'm doing is ongoing. I encourage all of you to get involved if you haven't already. You may have seen the flyer going around. It's a pink flyer, and the top of it says, "Your future, kids or no kids." If you'd like to see the flyer, I do have it on me. And I encourage especially UTech students to fill it out because it focuses on both UE and the University of Technology. So if you have any friends who are at UTech, especially women who are at UTech, please encourage them to fill out the form. What we've found so far is that the majority of our respondents who see the form and send it to their friends and so on, very young, they're between 18 and 24. They have no children, they have very little income, majority of them have below $20,000 in monthly income. And so though they're in their peak fertility years, they have no prospects of having children. So if the government is interested in children being born from these people, they would have to address that, right? That's one of them. The next thing is we added a few questions to give them space to share their thoughts. These are all optional questions, so we just wanted to see if they had anything else to say. Many of them have shared that I mean, they want children, but they want to be responsible. They don't want to have children knowing that they cannot bring them into a good life. They want to have children knowing when they can afford to, when they can give time to them, when they have family and friends support, partner support, etc., which are also factors we're measuring, how strongly they agree with the support of these people. Like, do they believe that their family would support them if I had a child right now? Would my parents help me? Would my friends help me? Would my partner help me? Those are very important questions that haven't been asked. So as much as we see people pursuing the goal of having more children in society, there's a lot more questions that need to be asked. I love that you brought up knowledge as well, because we actually we are measuring the knowledge of the persons who are doing the survey. I will not reveal the answers, the correct answers to the questions, in hopes that you will all do the survey as well. But there are questions about the rate of success of IVF, which I believe many people need to be educated on.
Yes.
Because many of us believe that we have more options than we do. And financially and medically speaking, the options do get limited at some points in your life. So myself and my supervisor, who is actually an embryologist, we designed those questions to identify whether knowledge was something that drove or would predict somebody's desire and intention to have children. So if they knew more about fertility, if they were more knowledgeable, would they tend to have children earlier or later? That's a question that we're looking to answer as well. So we do look forward to some very interesting information. All of this so far is preliminary. The survey is ongoing, so again, encouraging all of you to get involved, get into the data with me. And stay tuned, because I will be sharing more about this in the future.
Clap for Anna, man. Oh. You know, I like me a smart woman, you know. Yes, man. It just makes me feel inspired when I meet a smart young woman. And we're going to be best friends. You and I have much to talk about. You are in my gungo, as they say. Right? So let us open the floor. I'm sure some people in the audience had some things they wanted to say, some burning comments, questions, suggestions, concerns, hand gone up already. That microphone there, Sabrina, can you assist me, please? That microphone. A nice young lady gingerly put up her hand. And listen, this is a safe space, so express yourself. We really want to know what your thoughts are. Are you asking a question, my darling? Stand up so we can see you now. Introduce yourself and go ahead.
All right, good afternoon. My name is Ashmonique McIntosh. I'm actually here repping the AZ Preston Hall. So my question is that I actually had it since the gynecologist would have said policies, that things that you would want to see be put in place that could allow women to actually want to have children, and it would be better for persons to act like to raise the children themselves, like paternity leave, maternity leave, and all of that. But one question that I had, and it actually can be to all panelists as well, how long will it take, or what can be done for those policies to be implemented? What change, or what can someone do? What can actually change for those policies to be implemented? 1. 2, how realistic is it that that change can be made? And 3, if it's already being made, how long until these policies can actually work in our society, especially as a third world country, Jamaica, and all of that?
Okay, Ashmonique, thank you. I think that's an excellent question that you just asked. It's a 3-tiered question, so I'm just trying to make sure I remember everything she asked. But the first part was, what can we do? And I think this that we're doing now is the starting block. This is a very good initiative, because whenever you want to start to put policy into place, you start with open discussions. And you must start with the people who are going to be affected by this policy that you want to start. You never want it to be a situation where you're imposing on somebody, because then that's just a tyranny. That's not very diplomatic at all. So this, for me, having these kind of open discussions, that's the first place that you want to start. Second part of your question was? The second part is how long? What are the other things? So I think Jamaica has a problem with reproductive health. A lot of women don't know what's happening to their bodies. They don't know what should be required. So for example, if I were to pose the question, how frequently is a pap smear to be done, not to try to, try to make a difficult situation, most persons would not be able to answer that. But as women, that's something important that we need to know. Cervical cancer is one of the only cancers that we can cure. So that for me, I think reproductive education is an important thing, allowing women to know what's happening to their bodies. If I feel this way, having a painful period is not normal. We need to drive home these kind of things that will encourage women to go and seek medical attention early. Painful periods are caused by endometriosis. Unfortunately, it takes about 9 to 12 years to make this diagnosis. So what happens is by the time women actually seek medical attention, that disease process has gone through the gates. It has completely caused wreaked havoc, basically, and makes it now difficult for you to control it and to become pregnant. So reproductive education is going to be a major proponent to how we solve this issue. And then the third question, how long? Not very long. And you also asked about a cost perspective. If we are having education, it doesn't cost anything. It takes nothing for, me and many doctors, as you can see, both of us here are doctors. It takes nothing for me to take 2 or 3 hours out of my day to come into a forum and talk to somebody about something. That is cheap. That's a cost tag of $0. So it depends on what it is. Clearly, if we're going to talk about Jamaica implementing an IVF program, then that is something that comes with a hefty price tag, and that's different. And my friend Catherine raised a point. I'm just going to cheat and tell you guys that the IVF success rate is 25 to 30%. They're going to do it. They're just going to do well.
Plus the robots know. The robots know.
Yeah.
ChatGPT, they know.
Yeah. So, but Ashmani, the reason I mentioned that really outside of, a joke was to really put things into perspective for you. That those kind of policies that are going to have a heavier price tag, we don't need to look to those right now. We start from the basics. We start with the education, letting women know, putting in social reforms, simple things, having aftercare, it can't be that hard. Allowing women to feel supported, it can't be that hard. Implementing maternity leave, it can't be, not implementing maternity leave, but longer maternity leave, it can't be that hard. Exactly, and paternity leave, it can't be that hard. So, a lot of these things that we're talking about and that we're bringing up, if you really look at it from a policy perspective, it's really not anything that will take a mountain to move. It's really not. So these are some of the simple things that we need to get moving and get going so that we can get to the outcome that we're trying to achieve.
All right, I can address some of this. Just as a matter of transparency, you notice we're recording this conversation right now. This is the first of a series of discussions that we're going to be having across the island. I approached the Ministry of Health. I actually spoke with Mr. Tufton himself, the health minister, and I said to him, the same thing we've been saying all day. We cannot continue to have this conversation about the declining birth rate without involving the people who are going to be putting their bodies on the line to solve the problem. They agree. So when we finish this conversation, we're recording it. It's going to be placed in media spaces. We are inviting young people outside of the university space to continue in the discussion. And the purpose of this exercise is for the policymakers to hear you, see you, hear what you're asking for, and consider what you're saying when they're deciding on the policy. So they can have a comprehensive policy that is actually going to be effective. Because I don't know if you have been keeping track of it, but I have. Internationally, lots of governments are trying to solve their declining birth rate by throwing money at it. Money is not the only issue. There are women who are simply unable to have children. We've already spoken about the issues. There are women who want to have children, but they cannot afford to have children. There are women who are not interested in the children business at all. They can be somebody's rich auntie. My point is, unless we are considered in the decision making, whatever they present,
it's not going to be effective because we are the ones who are going to have to implement it. And that's the reason why we're having this conversation, so that our voices can be heard and be considered in the policy making. So that what they put on the table is something where we can say, yeah, all right, we said we didn't want look better price housing. No, it not looks so unattractive because at least me know say I'm going to have somewhere for my child to live. Right? So that is the reason why we participate in this exercise. It is slow, but at the end of the day, if we say nothing and do nothing, what are we going to achieve? Make sense? Mm-hmm. Anybody else have a question? Oh, sorry, you wanted to... Sorry, Catherine wants to have something. Go ahead.
If I might add something very quickly, one thing that is happening right now is that the political will is appearing. People want to change something because now that the birth rate is falling so sharply, it's affecting other things. It's affecting the economy. It's affecting our health systems. It's affecting our aging population. And so the government...
Point on me a while ago when you said that.
No. Overall, the population is changing. Don't get me in trouble. It's affecting everything. And so the government wants to solve this problem. The government cares now because it's affecting them. And to let you in on something as well, the survey that I'm doing, it hasn't been out for long. It's been out for probably 2 weeks now. I've gotten over 200 responses in the last 2 weeks. Women are interested, they are involved, they want to talk about their thoughts, they want to share their thoughts. And so forums like this are so important. And you will notice that things will start to change. It might not be in the direction that you want right away, but things are happening to make this happen for you.
Yes. And yes.
Hi, afternoon. Oh, let me stand up. I'm Dr. Kimoni Young. I'm a public health specialist. Less of a question, more of a comment. Dr. Spence had mentioned in terms of living healthier lifestyles to be able to actually reproduce. For those who don't know, non-communicable diseases, diabetes, hypertension, obesity are very linked to all fertility issues because they're all hormone-based. And there's a lot that Jamaica is currently doing in terms of battling that public health front. We can name them Jamaica Moves, Know Your Numbers, all those different things that they're doing. But if we don't address how we live our lives, fertility is going to be an issue because, as a gynecologist said, at least half of the men are the reasons why we can't give birth. So the question now goes to the gynecologist. What are we doing in terms of pre-pregnancy planning? I have learned, as we have learned in medical school, we will address the pre-pregnancy planning for those who are high risk, sickle cell disease, endometriosis, you name the high-risk persons. But what about the average Jamaican who decide that they want to have children? Where is that pre-pregnancy counseling to ensure that both mother and the father are in the best pre-pregnant state to actually affect or make change to this low birth rate that you're having? Because could it be that the reason we're having a declining birth rate is not the lack of women, but actually just not successful pregnancies because we're not healthy enough for it?
Excellent question, Dr. Young. And I think that I had alluded to this in one of my questions earlier when I said that we do need to have better pre-pregnancy care. The short answer to your question is that unfortunately it does not exist. And you did make a solid point that that really is where we need to be moving towards. So we need to be establishing these kind of pre-pregnancy clinics where not just high-risk women, like you said, so women who already know that they have a disease process that's going to make their pregnancy complicated, but the average woman who can come in and they have a conversation with us. We can start them on their multivitamins. We can start them on their folic acid. We can do a risk assessment and see how best we optimize our health going into pregnancy. Unfortunately, the only time currently that that opportunity exists is when a woman already has a baby. So she comes into us and she delivers, and we say to her, come in and see us the next time you want to have another baby. But right now, it doesn't exist. We do not have pre-pregnancy clinics where a woman can just walk into, unless you're going to go and see a gynecologist privately, then of course 100% it can be achieved. But publicly, it does not exist, and it's something that we need to explore.
Me write it down, miss. Me write it down. there is obviously an opportunity for a reproductive health education that includes pre-pregnancy. I got you. I wrote it down. I'm paying attention.
No, I am a small fish in comparison to Dr. Dunbar. But let me just brag about her for a second, right? She's the best senior resident I've ever had. Very thoughtful, very thorough, very good with her patients. So she's not just speaking from, oh, she knows a textbook. She knows how to manage a patient well, right? But in addition to that, for the average woman, right? I'm an average woman. I just exist, right? The fact of the matter is, if I'm relatively healthy, a lot of us have poor health-seeking issues health-seeking behavior, in general. It's a widespread issue in Jamaica, right? I had a 23-year-old come into the clinic the other day just because, she was having an issue with her back. You heard I said? Her back. With a series of follow-ups, basically, she came with her partner one time, and I had the unfortunate experience of him saying, and I quote, that he's not the reason that they're not conceiving a child. Mind you, they've never done any form of...
don't it?
Right. So, the thing is, they've been trying for years, whatever, it's not happening. But the health-seeking part of, when you think, when I went back, her lifestyle, not the best. And on top of that, we had done an ultrasound, she has PCOS, right? No. In general, I know that we're pushing, gym, protein. Gym and protein work, right? The gym, weight management, healthy lifestyle management, they do wonders for people with PCOS. The diet changes endometriosis, wonders for it. It does start by small things. It does start by how you're living the life. Unfortunately, the hookah, the vape, smoking, it's not going to do great
and
things.
using one rum to chase another
Right.
rum. I've seen it.
And something that we haven't necessarily touched on just yet. When we're coming to women's health, we also have to speak about STI transmission, right?
Yes.
Because the fact of the matter is, a lot of women have STDs, they're unaware. It's something that women can carry silently for years, and it does affect their fertility.
Correct.
We're not getting tested. First of all, an STD panel costs the minimum of $16,000. If
Some
we have
places give it away free, miss.
no
Free syphilis
for
testing.
syphilis and HIV, what about the other 9?
Yes, but some
What about
don't even take
chlamydia? What
advantage
about
of the cheap, and
gonorrhea?
the free one is my
That's
point.
okay, right. So, and that's the thing too, right? It's poor health seeking, it's shame, it's a whole lot of things. But these things have to come into place when we're addressing pre-pregnancy planning, right? You barely want to do the pap smear them, right? Granted, it's not even just barely you want to do, but sometimes we don't know. We're not aware. We're not taught. It's not something that is taught in schools, right? The time that we're doing history and sociology and all of that in schools, we can take out.
Miss, we need
time
to
for
learn
personal
history and
development.
sociology.
No, don't get me wrong.
We're at the University of the West
hold
Indies,
on,
miss.
hold on. Let me be clear. I'm not saying we're supposed to replace them. I'm just saying a 1 hour a week, starting from high school, about health and development would do so much for us. And not just, abstain from sex, because the fact of the matter is children are going to have sex. That's the fact of the matter. What happens after that? How do you prepare for things? Health-seeking behaviors. Your painful period, you can't go to school for 3 days. That's not normal. Things like that. STI testing, accessibility, education. It has to start from there. It's not just, we can take the supplements. Because, yes, that's important, but what else? You know?
Healthy lifestyle around. Now, hold on. Dr. Spence had a question.
Yeah, I don't know if you said it while I was outside, but I'm hearing a lot of the other issues that I think are critical as you talk about government policy. And somebody had mentioned this whole business of assistance with childcare as a government, as a real policy issue that needs to be addressed. I remember when I had my granddaughter, and I was concerned about the nursery childcare space that she was at, and I decided, okay, now there's one on campus. I prefer the one on campus, right? And when we went and found out, it was like $30,000 a month, because it uses a nice Montessori school method. It's really very nice. But if you want the best for your children and you don't necessarily have the pocket, It's very, very expensive. So this whole idea of normalizing quality child care so that it's not just those who can pay for it, who access it, but that it might not be Bloom, but it should be good, you know, as opposed to going to some places where your children are coming home, you know, they are hot, they are developing all kinds of respiratory issues, the child care people are not kind. I think that is something that is very, we don't have a child care. Yeah, we don't have it. And I work in, and I deal with government agencies that deal with it, and I know that it's not where it should be.
Yes.
There, and it needs more leadership around it. I think the other thing, and Rochelle works with Bureau of Gender Affairs, right? So we can give our message for carry back too. So, yes, we have to deal with. I remember head of School of Nursing, when I was doing my PhD, her PhD thesis was on gender-based violence in pregnancies. A lot of pregnant women in Jamaica experience GBV, and it comes because of that particular vulnerability. They are more financially vulnerable, and there's not enough conversation about gender-based violence in pregnancies and how what is the special policy prescription for that, you know, how do you intervene when women come to the health center for their monthly or however visits, you know, and you find out that they're at risk of, or they are involved in abusive relationships. How does the society support them and help them through it? And even, you know, do we have shelters that provide support? She also managed the national shelter, so Metro words. Do we have shelters that can provide support if a woman is in an abusive relationship in the middle of a pregnancy? And, you know, there are so many issues that we have, that policy can help to work out if it is that we have government and people who work in government, and I don't mean PNP, JLP, I mean people like Rochelle and government who are doing the work on the front line and who can provide the kind of context for us to say support is there for women who want to have children but who are faced with certain kinds of risks.
Just want to piggyback a little bit on what you said, because I think it's an excellent point that you made. And I think it highlights the point that I keep saying, that we need to support women more. I think domestic violence, as you mentioned, is something that I'm not sure why, but it's not something that comes to the forefront as much as it needs to, especially in pregnancy. The risk significantly increases. And just like what you have, it's almost a trauma-bond situation where she can't do any better because the man is who is supporting her. From the healthcare perspective, a lot of times when you can tell when somebody comes in with a man and she can't freely answer the questions and the man stick on to her and you can't get him to get away from her to ask her these kind of personal questions. And I think that one of the way we can tackle it, I don't know if Rochelle can help, but when I went to the UK and I saw how they deal with these kind of things, just because I guess, you know, it's more prevalent and they deal with this some more, if you go in the bathroom, you see a sticker that says if you need help, dial this number. You know, because a lot of times it's just that she is unable to get that kind of help, reach out and say that, boy, she really needs this help, because the man just will not give her a chance to be able to enunciate that this is what is happening to her. So simple things like that, if we can look into doing those kind of things, it can definitely help these women, especially, and they're particularly vulnerable women that we really need to be looking out for.
Yes.
So, I don't know why Miss Spence beating me up today, but it's okay.
No, man, it's inspiration.
It's okay, but yes, it's actually a conversation that we were having earlier this week about incentivizing pregnancies and so on. And I was talking with my shelter managers, and one of them said, okay, well, if the government are going to give me like a $200,000 a month, I will consider having another child. And then the other manager said, but what does that mean for us at the shelter? Because if it is that a man knows you're going to get $200,000 to get pregnant,
if he beat you,
what is going to happen? You are
skin.
going to have to ensure that you get pregnant so we can get the money. And so we end up with being in the shelter with women who are pregnant. We've had quite a few babies that have been born under our care within the shelter for this very specific reason, where she have two already, but then the man decides he wants another one. She doesn't have a choice in the matter. And then at 6 months pregnant, you see, he's giving her some serious hits, like knocking her head, bust up, everything. And at that point, we have to then trigger a whole lot of processes that we have to literally grab her out of that situation, put her in the shelter. And then when she comes to the shelter, she has another 3 months of pregnancy to go. We then at the shelter, who are not equipped to deal with all of that, have to then find the resources to do all of that. At that point as well, we're hearing this is the first time they're going to a doctor. So you're 6 months pregnant and you've never seen a doctor. You've never gone to a clinic. You've never gone to a health center. So all of that goes back to what we're talking about, the health and those kinds of things. So that is one thing that we're looking at it to say, yes, the implications of saying that you're going to incentivize women getting pregnant. But we have to look at the flip side. Does that mean we're going to have more incidences of rape, more incidences of gender-based violence? And we have to provide things in place to handle that. So that is one of the things that we're confronted with that we have to think about. But we've been talking about it a lot. The parental leave, it is something that we keep talking about because we keep emphasizing, oh, the women are to do this, the women are to do that, the women are to do that. And it goes back to the idea of the aftercare. We are saying, you see at my office all the time, women have to go pick up their children and they come back. And then in some offices, it's kind of frowned upon because literally I remember in 2015 when I just started working in this space, there was a young lady who had her baby and she had to literally put her on the desk because the supervisor was like, why the pitney come disturb the office? So that is something that even now, there are people there who are uncomfortable having their child. Me, for one, I don't take my child to my office any at all. I'm fortunate enough to be able to find the financial support so that she can stay somewhere where I'm comfortable with until I leave work, because I'm not taking my child to come to the office because I remember how it is that people treated you when you brought your child. Oh, you can't be productive anymore. And a lot of times these are actually women, and I would imagine that they would understand that, but that is not the case. So there's a whole lot of conversations that we need to have about how it is that we are asking women to do all of that, but are we understanding all the factors that are involved in those conversations? And I'm happy that we're having this conversation and having the right people involved after this, the Ministry of Health, the Ministry of Labor. Those are the people who need to be part of this conversation because they need to know how it is that you're asking these young women to go and have children, but what are you providing for them to ensure that they do have children?
All right, so we have quite a few questions in the audience, so we're going to take them two at a time. So if somebody have 100 questions, one question per person, please.
Hey, good afternoon, guys. My name is Reese Magon. And my question is, and I wrote it down so I won't forget it. This is within the scope of the university now. So what roles should universities and student leadership bodies play in preparing young people, especially young women, not only academically but socially and financially, for long-term decisions surrounding family planning and ultimately family stability? Sorry.
Young people.
Young people.
You are doing so well.
Sorry, my apologies. Young people. Thank you.
My short answer is education. I feel like we've been talking about this, right? It's a university, it's great. We're getting our higher education, we're getting our degrees, great. But the fact of the matter is money management, healthcare, prenatal planning, postpartum planning start with education, you being aware of things. You're not going to do better if you don't know better. So the university's role is education. You're already educating me in if I want to do my master's in business or if I want to do HR, great. But there has to be some resource that is available for education, especially, honestly, could even go beyond university or before when it comes to high school, right? So education is my short answer.
Yes, I agree. I think that works. And personally, I am very invested in reproductive health education, and there are barriers at the high school level for comprehensive reproductive health education, because there are a lot of people who believe that not telling students is protecting them. And no matter what the question, ignorance is never the answer. So it don't make sense. Do we have another question?
I just want to add to that point. He had asked about financially, how do we prepare university students? Put on your money from early, invest from early. Financial literacy must happen from a university situation. So that even to address the housing, if it is that you want the workforce when they're finished with university to be able to afford houses, please tell them from university what they need to do. What do they, financial literacy is important. Mandem.
Afternoon, everyone. My name is Anthony Mary. So my question is a bit different from everyone else's. So what I want to know is that, so as young men, most of us are planning our life after university to start our own families. What advice would you give to us pertaining that side of things, seeing that most of us didn't have a father figure growing up or anyone in our life of those other leadership? What advice could you give us for that?
Boy, the men them have some good questions today, though. Jesus. Who's coming next? I feel like the gender specialist should take this one.
Yeah. All right. So I personally don't give men advice because I'm not a man. But I will tell you this, that for us, what we have done is that we have the male network. And what we've done is identified male mentors who can provide the support. Because we recognize that a lot of the work that we do when we go into communities, this is exactly what is happening. So from where I stand is identify mentors. Identify mentors who can provide that support. And if it is that you don't have any within your space, then you identify persons who can provide that for you. So, for example, as I said, within the Bureau of Gender Affairs, we do have a male empowerment network, a male network that provides that kind of support. And so it doesn't matter where you're from, it doesn't matter what your background is, what your situation is, there are people who are across the country who we can contact and actually have you as part of that network. So what we do now is, some of the young men who would have, I don't know if you know about the Women's Center Foundation, where young women go who are pregnant and are out of school. So, oh, nice. So those, when it is that we're able to identify, or they're willing to say who the fathers of those children are for those girls who are at the Women's Center, we work with them. So, yes, of course. So we provide it's Young Fathers Initiative that we have as well within the ministry that does that. So there are a number of initiatives and programs that are out there, particularly, I can say, from the ministry, from that perspective that you can tap into to provide that support, if it is that you don't have mentors within your personal network that could provide that support to you.
Share some contact information, no?
My phone. No, there isn't. So that is why we have the Young Fathers Initiative. That is why we have the Young Fathers Initiative that provides that support for you if it is that you can't identify it within your network. So I'm finding the numbers. If there's anybody else who wants to comment and then come back to me while I find the number.
Hi, it's me again. Sorry. Again, I'm not a man. I will not pretend to understand the pressure. Because I feel like what young men definitely face pressure when it comes to thinking about fatherhood. We probably won't acknowledge it because you've never lived it, but it's there. But I think you have to go back to the root of these things. So one, healthy lifestyle. We know everybody likes to smoke, everybody likes to drink. How about doing these things in moderation? Especially in university, it's peer pressure. Okay, parties, all of that, it's great. But then there has to be some kind of balance when it comes to your lifestyle. Even emotionally, right? You spoke about absentee fathers, that a lot of you guys don't have father figures to model after, right? It starts with you unlearning certain things. So, okay, you're used to not seeing a father there, then okay, make sure that you are the present father that is there. How do you do that? You make sure that you are emotionally sound, that you're financially stable, and that you're healthy in whatever way and whatever capacity you can. And then, use initiatives from there to help to develop that.
So I'm the mother of a son, right? And my son has friends. And one of the things I noticed with him and his friends is that when they became fathers, they all knew the kind of father they wanted to be. But I think that happened because a space was created for them to articulate. This is who they knew, they always knew. And most of them never had fathers in their lives, right? when they were young, they imagined it, they knew that this is what I wanted my father to do. And I think men need to say, this is what my father didn't do, this is what I want to do as a father. And I think when they articulate that, because my son is a beautiful father, and his friends come together and they support each other and they're godfathers to each other's children and they buy birthday gifts and I can see how these young men who didn't have fathers in their lives are exemplifying good fatherhood. So I think men know, I think young men know, I think you should talk to each other about it. So I don't know how men do it. Say, yo, my youth, what your father do, what your father didn't do. If you have one pitney, what kind of father you want to be? I don't know. Perhaps that's how men have it. But I think you all should have the conversation with each other. And you would be surprised that you have really very evolved and sophisticated positions about the kinds of fathers you want to be. And I think as well, the women who are your partners need to make you real partners and ask that of you. Right? I think sometimes women don't ask that of men, and they should, because I think when they do, men rise to the occasion, right? So I think, I see it with my son that he's a fantastic father. And he never had a father, never had his father in his life. At 16, I had to tell him, Father, kind of stay away, because the periodic thing now work for your mental health. And seeing him now, I'm like, whoa, and men, they think that if men don't have men in their lives, they can't be good fathers. They can be. I think you are. But just talk about it and make it come to the fore.
So the numbers, you can actually call 876-553-0387.
That's the number for what? Remind them.
You can call the Bureau of Gender Affairs, the mail line that you can call. So it's 876-553-0387, or you can call the director himself. I'm going to call him after this and tell him that I gave out his number. But he doesn't mind. He's my friend, so he's fine. It's 876-818-1144. That's Mr. Miller. He's the director of male empowerment. So he will, once you call him, and if he can't provide the support, he'll direct you to where you need support, and you'll definitely be part of the male network that provides that support for young men.
Awesome, thank you.
So last thing, in terms of men becoming good fathers and preparing for fatherhood and family, I encourage them to listen to the women that they are partnered with. One thing that women want now is autonomy and support. They want partners that are equal. They want partners that will support them in their health journeys, in their financial journeys, in their careers, their academics. People who will see the whole person and not just see somebody who is a means to an end. Women, their health is at the forefront. Their financial and career stability is at the forefront. And so in preparing for fatherhood, I encourage you to educate yourself and to get aware of those issues. This is the right place to be, because we're having these conversations and you get to learn about some of the things that women care about when it comes to being mothers. And if you intend to be a father, I would hope that you would partner with somebody who would like to be a mother one day, and therefore know well how to support her in that journey of becoming a mother and becoming the mother of your children.
Can I add something?
That's an excellent point.
Can I add something?
Go ahead.
Okay, so this is more so of a proposition than anything else. And it's that as a young woman, I've been in a lot of spaces where I'm encouraged, I'm empowered, and spaces like this. However, I don't see same for young men. And I feel like they should have more men-led initiatives. Like I've had women-led initiatives, like more positive peers, role models, just a space where the men have created it for themselves that's positive. I feel like a lot of women-led spaces are here, and I've benefited from it. However, I don't see where that is same for men, and I feel like if there were more spaces for them to see other men that are doing well and they're empowered in whatever way, it would be beneficial. It would make for more positive male role models.
I agree, and this is an opportunity for us to call Mr. Miller and make some suggestions. If you didn't get his number before, it's 818-1144. He is the Male Empowerment Director over there at the Bureau of Gender Affairs. Blow up him phone then, please, and let's make some suggestions to him about how we can have more spaces for young men to get positive reinforcement and empowerment. I think that's very important. It has to be led by men. So that's why we're going to talk to Mr. Miller, because that's what his role is.
Yes.
Mm-hmm. Men, for men.
Yes.
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 But yes, and they have different needs. Correct. I think we have another question. Go ahead.
Good afternoon, I'm Brenna Palmer. So I have a question. So Shelly-Ann, you had said that this will be one of many series. So will this be on campus, as well as can you involve faculties and clubs and societies? More importantly, faculties that are research-based. So how can students help? We want to help.
All right, thanks. I like people who want to help. You know, we want to help. So make sure you put a star beside the name in the registration so we can identify you. Yes, we want to have this conversation in the Western campus, especially because, as you know, Kingston is not representative of Jamaica, and the women in Kingston have a different lived experience than the women outside of Kingston. So we want to involve women in different spaces. So we are definitely going to be going out of town. So yes to your question, and yes, we're going to be inviting other faculty and poor Miss Nadine Spence, because I'm going to be stalking her over the next few weeks. She she tell her before, so my head not quite good all the time, but it is important that we do this, because I really do believe that we need to reset and we need to change the way we have been doing motherhood and fatherhood and community. I mean, I hear everybody, I have my list on things that people require. I say increased wages, pre- and postpartum care, maternity leave, longer maternity leave, more robust paternity leave. Me write healthcare 2-time panelist because healthcare was very prevalent. I hear aftercare. I hear regulation on housing, so housing can be more affordable. You know what I don't hear? Spaces and places for play. Your name, put that on your list. Because I write down everything on the list when I didn't have my one in my hand. But it's okay. We are aligned. We are aligned. I just agree with you then. But yes, we need some parks and recreational spaces and places that people can carry them children and the children can be children. Because that point that Dr. Spence made about the fact that children are annoyances, truthfully, children don't belong in every space. But there are not a lot of spaces that are just for them either. So we have to balance it. If we can't carry them go everywhere, we need some places where we can carry them go. Not so? Right? So in putting this infrastructure in place, we have to think of places and spaces where children can learn and play and have fun and be creative. That has to be a part of it. Another question.
Hello, I'm Adrienne Smith. I'm from the Rotary Club in Umona. I would like to make a suggestion, which persons normally use TikTok to watch recreational videos and all of that stuff, where you can use it to educate you on things. So firstly, you mentioned financial stability. There are videos on TikTok that have persons who tell you how to manage your finances, invest, and other things. And you can actually search up things like the things that you're mentioning, and then you'll find your help. So you don't really have to call anyone, you just can research it.
Right, so you said the information is available.
Yes, because I've watched some videos on TikTok where they tell me how to invest on other things.
That is a good point. The information is available, so we can access the information. Sabrina, does she have a question as well at the front here? Go ahead.
Good afternoon, everyone. My name is Keshawn McGrath. Earlier, you were having a conversation about how male reproductive health affects female fertility. Now, my question is enough being done to both educate and reiterate to males that their reproductive health has an impact on female fertility across the space?
The short answer is no. But before we answer the question, I want to correct your statement. You said that male reproductive health affects female fertility. Male reproductive health affects fertility outcomes.
I think Catherine answered your question. The short answer to your question really is no. And that's why I made the point earlier that we need to do more with reproductive health to involve the males as well. I think a lot of it comes from ignorance, just that the men don't know that they are actually contributors to the problem. For example, smoking significantly affects the quality of your sperm. Sexually transmitted infections, most males will tend to be asymptomatic, meaning you have the infection, you have no symptoms, you pass it on to the woman, and then she gets the problem. So in that way, we kind of need to have more conversations with the men to get you more involved, to know the things that you need to do, optimizing your health. So Dr. Young made the point of non-communicable diseases. So you want to make healthy lifestyle choices, healthy meals, being active, not smoking, let me not say not smoking, but
Not
in
smoking.
moderation.
I say
not smoking, not drinking.
Smoking. I said it.
Not smoking, not drinking, because you want to be as healthy as possible to, as Catherine said, increase the fertility outcomes. Okay?
Yes. Go ahead.
Okay, good afternoon again. So my first question is more health-wise. So there were mentions of the fact that periods should not be painful, right? As someone who has seen periods during my teenage lifestyle and adult lifestyle, what do you define as painful? Because I've had situations where gynecologists talk at me and I'm genuinely confused as to what they're saying. And I've seen symptoms, but I just don't know exactly what they define painful as.
All right, so the first thing I'm going to do is to apologize for that experience that you said you've had, where you feel like your doctor is talking at you instead of engaging in conversation with you. The second thing I'm going to say is that pain is subjective. I can't tell you what is painful. You have to know what is painful for you. I think sometimes we tend to be a little bit callous in what our perception of somebody else's pain is, and we don't believe because of that. So you might see somebody come and say, oh, she's just being dramatic. No, if she's telling you she's having pain, and she should be treated accordingly. So the answer to that is that pain really is subjective, and if you recognize that you are dealing with a healthcare worker who is not listening to you, who is not addressing your concerns, find another one. Gynecologists are a dime a dozen. Just find another one. I guarantee you, there will be somebody who will listen to you and who will help you.
Okay, thank you. So my other question is more social-wise. In the university and young people sense, what would you say to a young lady who genuinely, it's like you've said, there's geriatric pregnancy and all, you're old and whatever, but what would you say to somebody who, one, they're living life right now where they're doing their degree, they're looking at life and whatever. What are steps, like health-wise, would you say, to preserve their reproductive health?
Okay, yeah, that is an excellent question. And the answer to it is to try to be in the best health that you can be. So people need to understand the concept of not only going to a doctor when you feel sick. There are general checkups, they're what we call well visits. So you just go in, you schedule a visit to see your doctor, you get your blood works done. We call it an executive profile. In that, we are screening you or checking you for these diseases. So the development of diabetes, the development of chronic hypertension, the development of high cholesterol levels, and then we try to put measures in place to control that. So like Dr. Young said, we encourage you to exercise at least 20 minutes, 5 days a week. And this needs to be moderate exercise. So not like cute walking where you're not sweating, you actually need to sweat. Your diet, having and maintaining a healthy diet. Staying away from recreational drug use, avoiding smoking, avoiding alcohol use. Those are some of the things that I would say would help you to be in your best health towards when you are ready to make that step towards having a child.
To also add from another perspective, IVF does exist. It may be expensive, but in terms
Just
of
a moment,
preserving
my good
fertility-
friend.
Yes, friend.
We have been assuming that everybody knows what IVF
Yes,
is.
let me.
Let's just
Thank
fix
you
that,
so
please.
much. So, in vitro fertilization. Do we know what fertilization is? I see some people saying nothing. Let me start from the beginning. Fertilization is the process by which a sperm meets an egg. We know the sperm comes from the father and the egg comes from the mother. They meet in the fallopian tube and then they implant within the woman's uterus, her uterine wall, her endometrium. So that process can be replicated outside of the body, which is why it's called in vitro, meaning in the lab, in a petri dish, in a dish. So what we do, not to test you actually, common misconception, but a petri dish. So what we do as embryologists, I'm not an embryologist, but what embryologists do is that they can preserve your fertility by extracting those eggs from you earlier on in your life and freezing them for you. Meaning, if you get to around age 28 or 29, which also might be a correct answer for the form, if you get to around that age, you can decide, okay, I won't have kids for now, but I know I won't want to have kids before 35. That's the age you guys used to? Geriatric, right. So since I know I won't be advanced maternal age, I don't want to risk my fertility declining and that affecting the quality of the embryos that I get. The embryo is a combined egg and sperm that has successfully fertilized and developed enough to be implanted into a woman. So what you can do, one of your options is to actually have those eggs preserved earlier on before that time comes. Because then when you're ready, you can go back to the IVF. No, I know that they can't afford it, but it is something they can look into. If it is an option at that point in their life, if they're in their career, they may be able to. I know of people, having worked in an IVF clinic, who take loans because their fertility is that important to them. There actually is. There's a JMB loan. It is the first of its kind in Jamaica. But it is specifically for mothers in terms of their expenses associated with maternity. So, for what? Yes, people even mortgage their house, and there's a lot of things. People value their fertility a lot, especially the men.
These are the people we need to hear about, so the ministry
So there
can help them.
are literally loans that exist because of it. And if it's not for that specific loan, people take unsecured loans as well to come and do those things. So I'm not encouraging you to do that. But what I am saying is there are options. I don't know if they are satisfactory to you, but we're bringing them to the fore so that they can be also brought to the ministry and looked into to improve those options. Because I don't plan to take a loan for any of those things either. I don't plan to.
All right, so as we wrap, yes, this has been a great conversation. And before we release our friends from hold back the microphone. Hold back the microphone. I'm going to give each of the panelists an opportunity to give a final word. You know, it can be whatever you like, and we want it to be under 30 seconds. I know say you're very wordify. So, just a final closing word as we wrap this very interesting conversation.
So in closing, I think the main takeaways that I want everybody to remember is that we're trying to optimize our health as much as possible, to be educated and empowered, and lastly, remember to add your voices to the conversation that is taking place. Don't have people speaking at you and around you. Actually vocalize and make your issues heard and your concerns known so that they can be addressed.
Basically, piggybacking off of what Dr. Dunbar said, education is one of the most, especially when it comes to this issue, it's one of the most powerful things that you can have and utilize in your education. So your wellness is at the forefront, start there, and then you can build up on that.
So, different perspective. I believe that what's happening right now in society is a very powerful situation because not only are we seeing the fertility decline, which, of course, in government terms is a bad thing, but we're seeing women take control of their fertility. We're seeing women who are more educated and more aware of their options, who are more interested in their futures beyond just letting life happen to them. So as university students, I encourage you to continue to educate yourselves, continue to get involved in these conversations, continue to learn, continue to make your own choice for your future as a woman and as a mother, if you so desire, in your life.
So for me, what I want you to remember is that a lot of times you hear people talk about the importance of everything starting at the university, the protests that have changed a lot of Jamaica's landscape of politics, everything over the years. This is where it starts. And so if it is that you have forums like these that provide opportunity for you to engage. And if it is that you sit together and have these conversations and you want people to facilitate it, I promise you Dr. Spence is always here. She listens to students even when she doesn't want to. She will listen and she will facilitate you. She'll point you. She'll point in the right direction so that you can find the support, because what is happening now is going to impact you more than anybody else. The people who are making the decision now, most of them are beyond childbearing. That is the reality of it. And most of them would have done their life. And so it's important that you make those decisions by letting your voice be heard so that whatever comes after this, it's your voice. It is what you want. So it will impact you, so it actually works in your favor.
I kind of want to piggyback as well. I just want to say that we're at this stage in our lives where we have the choice and the opportunity to make the most of our lives. I also want to add that we're in an age where everything is readily available. It's all at your fingertips. Go ahead and do the research for yourself. Do not allow others to come in and make those decisions for you, because let's be real, we can take out a phone and type in anything and find out that information for ourselves. So instead of waiting for that information to come in and redirect your life, make those decisions for yourself.
Thank you so much. Put your hands together for our panelists, please. And this has been so fulfilling for me. I've gotten so much out of this conversation. And like I said, it will continue. So everybody just ready up on yourself. We're going to be speaking afterwards. You see the cameras here. We're going to be doing a little bit of vox pop. So if you want to sound off on camera, please make yourself available. The opportunity is going to come up for that. And for me, my final word would be continue to speak up. Speak up amongst yourselves. I see different leadership here in the room from the university. Feel free to have your own conversations. If you want us to come and participate, invite me, I will come, because this is what we're going to need to do, especially if you want to be a part of the decision-making process, as whatever plans are being made to address this issue is being done. We want to ensure that you are at the table, because this is going to be something that directly impacts you. Thank you so much. Let me hand back over to our moderator.
Mr. Guys, if you never learn, you see my paper? You see when you come to these little things, young people know for right or type, you understand? Let us give the panel a round of applause for the expensive information. Alrighty, so all good things must come to an end, but I think this is the start of something good, as Auntie Shelly just mentioned. As we come to the end of babies, bills, and big decisions, I want to thank everyone for making this conversation meaningful and impactful. Firstly, let me give sincere thanks to our presenters and panelists for sharing their expertise, experiences, and perspectives with us today. Let us thank Dr. Nadine Spence. Let us thank Dr. Shade Dunbar, Catherine Lloyd, Dr. Jade Troy, Mrs. Rochelle Graham Barnes, for taking the time out of your busy schedule to be here with us. It means a lot. Your contributions have helped to deepen our understandings of realities surrounding women, health, and economic pressures and decisions young people are making about our families and bodies. I also want to thank Amoy. You know, she's talking on behalf of the university population as well. Your contribution as a young woman in this space is really remarkable. Conversations like this remind us that the issue of Jamaica's declining birth rate is not just about statistics. It's about people, choices, opportunities, and conditions under which young people are expected to build our lives. Let today not be the end of the conversation, but the beginning of more dialogue, more listening, and more inclusive decision making. Thank you for your time, for your insights, and your willingness to engage in this important discussion. And have a wonderful evening and safe travels.
That's it for this week's episode of Everyday Period. That nice, see? You see how them smart, you see? Listen, we did the right thing. We came to the source. We found out some things because we cannot solve this thing if we don't know what's going on with the people who are involved in doing the work. Doing the work. You see what I did there? All right? So, I hope you are listening. We're going to be doing more of these episodes because Everyday Period have to come out of the studio sometime and go up on the outside. I am a girl, Shelly-Ann, the period lady. I'll see you next time. Take care. Walk good.